Hello, my name is Dr. Dina Goname. Today I will be speaking about telehealth and what you need to know. So the topic will be about telehealth and telemedicine, and the focus will be on older adults. The learning audience for this topic is healthcare professionals and community members. I am Dina Goname. I'm a staff psychiatrist at the VA New York Harbor Telemental Health Hub. The first part of this talk will be about understanding telehealth, an introduction. The objectives for this talk will be that the learner will be able to understand definitions of telehealth and telemedicine. They will be able to define telehealth terminology. They will be able to identify the different modalities of telehealth, and they will be able to understand the benefits and limitations of telehealth. So telehealth actually has a pretty broad definition. It is a collection of means or methods for enhancing healthcare, public health, and health education delivery. And telehealth encompasses a broad variety of technologies and tactics to deliver virtual medical, health, and education services. Telehealth is not a specific service, but a collection of means to enhance care and education delivery. As we can see in this next slide, telehealth encompasses a broad variety of different technologies. So in the first picture, you can see that this is a live video interaction. So this is a two-way interaction between a person, such as a patient or caregiver, and their provider. And the provider is using audiovisual telecommunication technology. This type of service is known as synchronous or real-time service. And it may serve as a substitute for an in-person encounter when that in-person encounter is not available. The next topic, type of telehealth, is mobile health. This is a relatively new and rapidly evolving aspect of technology-enabled healthcare. It can include things like sending data alerts about disease outbreaks. It can also include just sending text messages to the patient to remind them to take medication. So this is a new type of telehealth technology. There is also remote patient monitoring. Remote patient monitoring is a type of technology where a patient will be wearing a monitor that will monitor things like heart rate, it'll monitor things like blood oxygen level, and this information will be transmitted wirelessly and securely to the provider, who will then be reviewing that information later. Telephone actually is a type of telehealth technology. So this is a two-way interaction, very old school interaction between the patient and the provider using audio-only communication. And then there's store and forward technology. So store and forward technology is basically where a picture of a lesion or an MRI or X-ray is taken, and then it is sent securely to the provider location so they can see it later. This is also known as asynchronous telehealth because the patient is transmitting the information at a different time than the provider is looking at the information. So telehealth has a very broad definition, but telemedicine actually has a pretty specific definition. This is the New York State definition of telemedicine. Telemedicine means the use of synchronous two-way electronic audiovisual communications to deliver clinical healthcare services, which shall include the assessment, diagnosis, and treatment of a patient, while such a patient is at the originating site and the telehealth provider is at a distant site. So this is the New York State definition, and this is the definition of telemedicine that most people think of when they use the term telemedicine. So telemedicine can have many benefits for clinical care. The first one is that it's extremely convenient. So the patient usually doesn't even have to leave their house, and the provider often doesn't have to leave their house either, so there's no need for travel. A second benefit is that access is really easy for a lot of patients. So if they have an internet connection and some sort of device with a camera, like a smartphone, they should be able to access their provider for a telemedicine visit. Now, this isn't true for everyone. So there are some patients who actually still will have trouble with access with this type of technology because they don't have a good internet access. For example, they're in a rural location, or maybe they're older and they don't have a smartphone or a laptop. So access isn't always easier for everyone. It's just easier for some. The third benefit is that telemedicine in many studies often has equivalent outcomes to in-person care. So some studies show that the accuracy, treatment, and effectiveness of telemedicine is equal to the accuracy, treatment, and effectiveness of an in-person visit. Similarly, studies show that patient satisfaction for an in-person visit is the same as for a telemedicine visit. Number 4 is that patient privacy and confidentiality issues parallel in-person care. So studies show that telemedicine privacy issues are not inferior to in-person care. The 5th benefit is that telepsychiatry effectively leverages specialty expertise. So for example, if a patient lives in an area where there are very few specialists, this is a very good way of getting them access to a specialist. And number 6 is that this can facilitate team-based integrated care between different providers who are located in different locations. Telemedicine can have benefits for specific populations. So some populations for which telemedicine may have particular benefit are geriatric and debilitated patients. So these patients often have mobility issues. So they obviously will have difficulty getting to a clinic. So this can be very helpful for them. It can be helpful for rural populations who do not have a clinic nearby or who do not have a specialist nearby unless they drive hundreds of miles. It can also be beneficial for patients with autism. So patients with autism will often have trouble with social interactions, so it can be helpful for them to have a camera or some sort of technological barrier between them and the provider. Similarly, patients with severe anxiety, let's say someone who has agoraphobia. So that type of patient will have difficulty leaving the house, and they may not be able to see a doctor unless they can do it through telemedicine. So there are definitely benefits to telemedicine, but there are also disadvantages to telemedicine in clinical care. So when you see a patient through telemedicine, there are aspects of the physical exam and interaction that are lost. For example, you can't smell the patient. So a patient who has an odor of some sort, let's say they have poor hygiene, or they have alcohol on their breath, or let's say they have ketone smell, you wouldn't be able to notice that during the telemedicine interaction. Additionally, you can't touch or feel the patient. So for example, in my clinic, when I want to see a patient who is taking antipsychotic medication, I want to check them for rigidity. That is really hard to do in a telemedicine visit. So unless I have someone who is trained at the other end, let's say the patient is in a clinic in a rural environment and there's a nurse who can check for that and let me know if that's going on, then I won't really be able to know if that's going on. Another thing is lost is that sometimes the big picture is lost. For example, you don't usually see the patient walk into the exam room, so you might not be able to tell what their gait looks like unless you specifically look for that or you specifically ask to get a video clip of that. There are also problems with telemedicine in specific populations. So for example, patients who are very psychotic, especially patients who are paranoid about cameras or paranoid about government or corporate monitoring, this can actually make their symptoms worse. So this population probably wouldn't be a good candidate for telemedicine. Additionally, agitated patients can sometimes not be a good candidate for this, especially patients with dementia who get agitated if they're really disoriented while they're talking into a camera or a screen. So unless the patient is with a caregiver who can calm them down, sometimes this isn't a really good modality for them. Another population which this may not work for are patients who are at high risk for harm to themselves or others. So these patients, obviously, you may need to involuntarily hospitalize them, and it's much harder to do that if you don't have them in a facility. You will have to end up calling local police or an emergency contact and trying to arrange that from afar, and that can be very difficult. Another special population that might not be a good candidate for telemedicine are patients who would benefit from controlled substances. So up until recently, up until the COVID-19 pandemic started, there was a rule called the Ryan-Haidt Act. And with that rule, you actually had to see a patient in person at least once before you could prescribe controlled substances. That has now changed, so there's a waiver on that during the public health emergency of COVID-19, but presumably that waiver will be removed at some point. I wanted to talk a little bit about geriatric telepsychiatry and some special considerations you may want to think about in the setting of geriatric telepsychiatry. So one thing you may need to think about is that these patients may require greater staff assistance or greater caregiver assistance. For example, if the patient has hearing problems or vision problems or they're agitated, they may need to have a caregiver who can help out at their home during the visit, or they may need to have like some staff or nursing staff who can help out in getting the telemedicine visit going. Another important thing to consider is if you will need to actually zoom in or zoom out. So sometimes you'll want to like have a camera that has the capability of zooming out to see a patient like walk, or to zoom in perhaps to see a patient's tremor. Obviously you won't be able to do that at home, but if you can get them to a clinic that's close to them and use a camera over there in that clinic that can zoom in and zoom out, that makes things easier. An important thing to remember is that telepsychiatry can be really helpful because a lot of studies have shown that the assessment, cognitive interventions, and outcome results have been similar in telemedicine visits as compared to in-person visits. Another important area is nursing home and home outreach. A lot of patients suffer without access to care in these environments, and this is a very efficient way to deliver specialty expertise to them. I also wanted to spend some time talking about geriatric telemedicine, especially in the treatment of chronic illnesses. So geriatric telemedicine has been shown to reduce emergency visits, hospitalizations, complications, and increase quality of life for patients with certain chronic illnesses like diabetes, hypertension, pain, congestive heart failure, etc. So basically, the treatment of chronic illnesses with telemedicine has been shown to be superior to in-office visits in some of these studies. Geriatric telemedicine has a lot of potential in the home care environment. There are some really innovative methods of using telemedicine in the home care environment. For example, you can have simple monitoring devices that can assess a patient's gait, pace, activity level, sleep, falls. You can also have monitors that monitor a patient's blood pressure, pulse, oxygen saturation, and weight. All of this information can then be transmitted to a health management office. If any of these parameters look off, a physician's visit can be scheduled via telehealth. Ideally, presumably, a telemedicine intervention can be scheduled around the clock if there is a staff for that. And telemedicine can be used by nurses to transfer images, to evaluate skin lesions or gait, and to discuss telemetry data. Additionally, telemedicine in the home care environment really helps reduce caregiver burden and caregiver sense of isolation in the home. So it has benefits for the patient and the caregiver. Additionally, geriatric telemedicine has a lot of potential in the nursing home and adult living facility environment. In some studies, regular use of telemedicine significantly reduces emergency room visits in this environment.